Ladies and gentlemen, welcome to today's event, one of the series of morning coffee meetings organized at the Medical University of Gdańsk as part of the Year of Communication and Intercultural Integration of the community of the MUG. We have launched this initiative coordinated by the Department of Internationalization to promote and reinforce more open, friendly and satisfying relationships between the members of our highly international academic community, as well as their stronger bonds with the home university. Most of the activities will be carried out as part of a project within the Welcome to Poland program operated by the NAWA, National Agency for Academic Exchange. For today's meeting, we have the honor and pleasure to welcome two distinguished and renowned researchers, academic teachers, and foremost physicians in the area of cardiovascular medicine, experienced physicians and dedicated medical teachers, gentlemen of multiple merits to both their home universities and global medical science. Ladies and gentlemen, I am most pleased to introduce to you Professor Paul Gründeman and Professor Krzysztof Narkiewicz. Our guests' CVs and lists of achievements in clinical medicine and medical research alone would be more than enough to fill the time allocated for our meeting. Yet, at least a few words of introduction seem just necessary. Professor Gründeman is an associate professor in experimental cardiothoracic and vascular surgery, University Medical Center in Utrecht, the Netherlands, and also a visiting professor at Cardiovascular Surgery Center of Translational Medicine, Medical University of Gdańsk. He graduated in medicine from the University of Amsterdam, where he also obtained his doctoral degree. Professor Gründeman's research focus is on innovation in the field of cardiovascular diseases and development of novel devices and therapies. He has extensive experience in experimental cardiovascular surgery, especially in the field of minimal invasive surgeries and technologies. He is a co-inventor of the octopus tissue stabilizer, invented for closed chest beating heart coronary surgery, commercialized by Medtronic Incorporated. Currently, as inventor of the spacemaking device and suction knife device, preclinical feasibility is being explored for intrapericardial therapies. In his career, Professor Gründeman has been active at several healthcare and medical research institutions in the Netherlands and abroad, Beijing, China, and Gdański Uniwersytet Medyczny, Poland. Professor Paul Gründeman is a holder of the Medtronic Customer-Focused Quality Star of Excellence Award for Distinguished Performance. In his honor, the ISMICS named one of their awards Gründeman Scientific Innovation Award. Professor Krzysztof Narkiewicz is head of the Department of Hypertension and Diabetology, Medical University of Gdańsk, graduated in medicine and obtained his doctoral degree at our university. For 2 years he was a visiting scientist of the National Institutes of Health at the University of Iowa in Iowa City, USA. He has established the Center for Translational Medicine, which serves as a platform linking several research groups and focusing on functional and structural analysis of the heart and vessels in humans to explore cardiovascular system control and cardiovascular morbidity. His research has been focused on the role of the sympathetic nervous system and metabolic factors in regulation of cardiovascular function in physiological and pathological states, including hypertension, coronary artery disease, congestive heart failure, and obstructive sleep apnea. Professor Narkiewicz has published over 450 full-text papers, mainly in the areas of hypertension, and he was a member of the Task Force for the Management of Arterial Hypertension of the European Society of Hypertension. Your CVs are much longer, but we would like to go now to the main part of our meeting, which is this interview. So I would like to, in conjunction with your CVs, ask the first question, which is, what were the key factors and turning points important in the development of your careers as physicians, academic teachers, and researchers? Professor Gründeman.
Well, thank you very much. In the first place, I gladly accepted this invitation because it's a sort of an unusual place and unusual time point for me as well. It's sort of at the end of my career, hopefully not completely at the end of my career, to expose a little bit of my driving and impetus. What did me actually take me to this point today here. So thank you very much again for the invitation by the University of Gdansk, Medical University, I should say. Well, the turning points, I would say there may be a couple of them, but let me first bring the first. The first that I was actually put on the routing of being a doctor was my history of my dad. He was a surgeon in Amsterdam. My mom was a nurse. So I was in the environment of medics. And as a kid, I was actually feeding the dogs that my dad operated for heart valve surgery in the early times of open heart surgery. And I saw this heart-lung machine in his lab standing there. And immediately, because I was dealing with mechanics, so this was one of the turning points that I like to work with technique and medicine as a combination. So this was the first turning point. And the second thing is just that I was very lucky to be part of the team that started open heart surgery here in Gdansk. And I think Krzysztof Narkiewicz, Professor Narkiewicz can tell a little bit more about it because his mom was very much involved also in that. That gave me the sort of the international flavor. That was another push. One more, I think, important thing is that sometimes you must have luck. So when I finished my graduation as a doctor, I was already exposed for many years using the heart-lung machine in clinic. So I was already a surgical assistant, of course not taking first responsibility, but I was able, to oversee the field already. And when I graduated as a doctor, I really wanted to move on the field of heart and vascular surgery, because of there I saw the opportunities to meet technique, innovation, and improvement for patient care. And I was lucky, because at some point I got a telephone call from a professor of cardiology who was not a surgeon in Utrecht. I was in Amsterdam, and he asked me to team up for his team to look for improvement in cardiac care for patients who should undergo bypass surgery. And now immediately I was sparked by that. So I was lucky to have composed a team. I was appointed as a project leader in this surgical lab, cardiology lab, by the way. And well, then we invented the octopus. Also luck. And the other luck is that it went so well that we conquered the world with that. So how lucky can you be that some device that you develop as a team, and I want to emphasize this, that we were really as a team on the threshold of, let's say, technicians, mechanics, doctors, professors, also administrators, that made it us as a great team. So that was a lucky moment in my life, and that took me actually all through my career. So yeah, these are important points, of course.
Thank you very much, and I'm pleased to hear that success and development of the career is not only talent and hard work, but you mentioned the spark of luck on the way. Professor Narkiewicz, could you please say a few words about that?
I think there are several important moments in my life. First of all, the environment of the medical university, my parents. As you know, my mother was a cardiac surgeon. My father was a scientist interested in the brain. So from the very beginning, I was exposed to clinical medicine, but also research, and probably I decided to choose something a little bit in the middle. I didn't want to work with my mother for various reasons, and but also I didn't want to do only research. So this is the reason I tried to combine. So I think I'm more or less a kind of child of the university because I spent my first 7 years of my life with my parents, living in the building which now belongs to Uczelnia Badawcza office. So this was my room for the first 7 years. The school just nearby. I attended the school, and then pierwsze liceum ogólnokształcące, so high school nearby. And it was a turning point in of the history of Poland in 1981. So I witnessed the Solidarity movement, and also the state of martial law. Well, I was already a student. I feel very young, but at the time of my first year studies, it was the state of the martial law. So if somebody at that time in 1981 had told me that I would live probably in one of the most fascinating cities in Europe, in the world, and I would work for really excellent universities and a state of art of the hospital, probably I would never be able to believe this is possible, doable. But on the other hand, if somebody had told me in 1981 that Lech Wałęsa would be the enemy number one, also would be very difficult to believe. So I think it was the first very important component of my family life. Then the second turning point was my fellowship in US. As you mentioned, I spent almost 3 years. And I strongly recommend, this might change your life if you decide to go for a fellowship abroad. I left Poland, it was 1996, already a while ago. Still very old hospital, no resources for research. And I went to Mecca in cardiovascular medicine. Beautiful hospital, a lot of money. This was the beginning of the second term of Clinton, a lot of money for research. So when I went there, I thought maybe 1-2 papers in hypertension. We ended up having 10 papers in circulation, the best journals. I think it was really a kind of eye-opener. And finally, the third turning point was when I joined the Scientific Council of the European Society of Hypertension. So I became just a member of the council, then I was the secretary, and then I ended up as the president of the society. So it's also somehow allowed me very close contacts with the best scientists in the world, contribution to the guidelines, and then really I believed that sky's the limit. So I think it was really very, very important. And I thought this was the right decision to come back from the States because I had several proposals to stay over there, to come back to Gdańsk, and with this vision that new developments, new hospital, new universities, and actually I'm convinced it was a very, very good decision to be back. And I still have many friends all over Europe in cardiovascular medicine. So I think it's also a very good way to expose your research. Try to join any society in your field, and think about international exposure.
Wonderful. Thank you very much. The next question comes in conjunction with what you both mentioned, your family history. And it is natural in science that people cooperate internationally, but maybe it's part of a less common scenario that this cooperation goes from generation to generation. And this is actually the case of cooperation between you individually and our institutions. So it all started with a certain dose of luck again, but what would be the key thoughts about the origin of this and milestones in the story of friendship and cooperation, because that's what we should call it probably in the best way in the generation of your parents? How would you consider this?
Well, the first consideration, and I must admit, he became a brother over years. So we met each other, I think, first time already in the early 70s, 1974, 71 already, when he came with his mom to the Netherlands. Because his mother came actually to the Netherlands because of a very funny situation. And I will refer to the topic of the importance of building personal alliances between people. That is key to success of building new pathways of medicine. My dad was a leading cardiac surgeon in Amsterdam, and he wanted to expand his practice, and he had a colleague, a Polish surgeon, who was a refugee originally and worked with him. That was Dr. Sienkiewicz. And Sienkiewicz wanted to do something good for his country, because he was in the Netherlands and he saw the struggles of Poland. The Iron Curtain was in place. It was a very difficult situation actually in Poland. And he wanted to have doctors coming from Warsaw to Amsterdam. That's logic, because he came from Warsaw. But all of a sudden, there was Dr. Narkiewicz coming from Gdansk to Amsterdam. She was in front of his office. So that is the alliance started, because it was just because she got a passport and the Warsaw doctor did not get a passport. So my dad said, it will be the first time I will ever train a female surgeon. But he did, and he was very committed to her. So that is how it started. So she was invited to come to Amsterdam in 1971. Krzysztof came with her, was on Dutch school even, in Amsterdam. And we got to know each other. And then the typical needs that were exposed to us. What was needed? And then you start to have, let's say, a goal, a friendship. Personal, let's say, relations. Actually, on that was built, let's say, the mutual, let's say, starting the heart center here in Gdansk in 1975. I think around that year the first open heart operations were performed, because we brought our heart-lung machine here. Family Narkiewicz was many times with our family. So this is the personal base. The touch is that we became friends. We became a sort of a family with one goal. And more people joined that family. Cardiologists, radiologists, administrators, hospital directors. But one key is very important. We want to have a heart center in place here in Gdansk, not to operate Polish patients in the Netherlands, because we would not bring the system and the knowledge and the experience to Gdansk. We were just helping a number of patients. That was my dad's strategy. So I was part of that team, driving the car, starting the heart-lung machine. I was a teacher in extracorporeal circulation for my colleagues here. I was a medical student at the same time, so I was not a doctor yet. But it was, to summarize that, this time was extraordinary, because Poland was in despair. Communism was here. The shops were remont, so to speak, in Polish. There was nothing here, except, we brought the sugar, the coffee even, in the cars. And what it started here is a sort of enthusiasm. And so, summarizing your question, the most important thing is that you can only achieve, let's say, almost impossible thing if you work together on a friendly way, on a friendship way, and that was a big experience for me, and very lucky. Actually, it changed my personal attitude in life. Actually, having that experience, so I'm very grateful to that, to be part of that team at that time. So, did I answer you?
Thank you very much, and we are very grateful to everything that happened due to this friendship and cooperation. Krzysztof, would you like to add anything to this?
Well, I think that both our parents, your father, my mother, they had really very close relationship in terms of understanding the needs of surgery, and they were really excellent friends, and from the very beginning. And I think especially for my mother to be the only cardiac surgeon abroad and so on, probably was an enormous challenge, but she managed really very, very, very well. And I think she was really exceptionally prioritized on the building the teams, the relationship, and so on. So with the father of Paul, with Professor Anton Gründeman, but also with the others. She tried to convince to train more people, because actually the stay of my mother was followed by training of some other cardiac surgeons from Gdańsk. People from intensive care went also to Onzelive. So I don't know, between 12, 15 people, nurses and so on, were trained. So it was a kind of at that time in the 70s was unbelievable to do it. And then she convinced also the group of cardiac surgeons to bring the equipment. And you can imagine to transfer the equipment through East Germany without any kind of official license paper. It was really incredible what they did compared to the situation right now. You order, you send a parcel by a courier and so on. At that time, it was really amazing. So I remember, when they came for the very first time. When I went for the first time to Amsterdam, I was 10. I was probably at that time more interested in soccer than medicine. And at the time, Ajax Amsterdam was the best team in Europe, and there was a very famous player, Johan Cruyff, and one of the physicians working in the hospital was also a physician of Ajax Amsterdam. So I had the chance to see Ajax Amsterdam training at that time. So which was very, very unique. But later on, when the family, Gründeman, Paul, but also his brother, they brought the equipment. I remember that my room actually turned into kind of a storage place where they put all, the devices, equipment, and so on. So I think it was really a very, very unique setting to get this relationship. Later on, it became a little bit more formal. So there was a kind of agreement between the universities, the Polish embassy started to be involved. But at the very beginning, it started really from a personal relationship. And I think this is the way to go. First, to establish kind of personal contact and then sign all the agreements and so on. Because sometimes there are several agreements signed by the institution, but if there's no personal factor, it doesn't work in our case. And then, somehow after many years, Paul is very young, but he retired in Utrecht and started the discussion why to renew this interest of Paul in helping Gdańsk, and then this is the reason he came here, and he's trying to help us with different aspects of organization of the university, but also the hospital, trying to somehow expose us to the best examples of this time not Amsterdam, because Paul moved to Utrecht, but Utrecht is really a university which made enormous progress in the last 20 years, because probably 20-25 years it was always a very good university, very old university, but in terms of global ranking it was rather far. But then suddenly they created the center, also clinical center. And they focus on innovation, entrepreneurship. They had PhD courses in English, and suddenly Utrecht started to rise, and now it's one of the best universities in Europe. So I'm convinced that trying to strengthen the relationship with Utrecht, this is what we try to do. This might help to get our clinical affairs to the comparable level of this what is happening in Utrecht. Also research, including the European grants and so on. So I think it's still a long way for us to go. Try to catch up Utrecht as the university, but Paul is also facilitating this process. He knows everyone at the university. I think it's also kind of personal contacts that we have, and we'll benefit from that absolutely in the next months to come.
Well, thank you very much. You've actually reading my mind, because that's the content of the next question. But I would like to refer to your answers on this friendship and cooperation question. I have the impression that the battlefield-tested recipe for success is trust, vision, and determination, which have been proved by the generation of your parents and is continued by you in much more favorable conditions. But things were possible which, as you said, were the result of cooperation. So the next question is about the potential and reputation of the university. Our institutions are a little different and have different position. And the question is, what do you think are the key challenges and most valuable assets to be used in the process of making a progress as a university in both research and teaching? The key assets and the key challenges on the way of building a stronger position.
I personally think that we should first redefine and relook about the mission. Why are we here? We are here for the healed patient. So I personally never make any separation between patient care, clinic, science, and teaching, because it all boils down to one thing. It's everything that we do together as a group for a healed patient. So, Medical University Gdańsk, I think, has a regional function in the north of Poland, in Pomeranian, in the entire area. And I think that we have the obligation to strive for excellence. And this excellence can only come when we relearn a little bit how to cooperate a little bit better together. And I say better because I noticed that there are some issues that need some attention. If I had the point of view from Utrecht, how I was taught over the last 20 years. That means that the different disciplines should a little bit step over their shadows from the past. So we should actually focus again on the primary goal, is that everything that we do is for this healed patient. So that's why actually I started the initiative about 1.5 to 2 years ago to get a cardiovascular center in place in Gdańsk University Medical Center, which is actually the fusion of the clinic and the university. So this is a sort of, let's say, artificial separation that grew over the history of this great university, hospital and medical university. But it's artificial. It's guided by laws, guided by administrators, guided by people who actually have nothing to do with the healed patient. So we have a job as doctors, researchers, and teachers to come back to this original mission. I would not say that we should not obey, let's say, our political leaders in this country, but I would say that we would, let's say, give a different interpretation to that, which is not in conflict with laws. Now, having said that, actually we want to go to the cardiovascular center, the Center for Cancer, the Cancer Center, the Center for Infectious Disease, the Center of Women and Baby, Center of Brain. A little bit on the same sort of format that Utrecht has achieved over the last 20 years. Also, Glasgow University, you have a great alumni working there as a dean, you know, and that is Anna Dominicek. She is also part of this whole thinking. So my work actually currently out of the Central of Translational Medicine is to pull together the people, reset a little bit the mind that we are here to work together. We are not working in separate silos. Actually, we are one silo, but we are cardiologists or cardiac surgeons or radiologists or whatever. But we should work horizontally with open doors. And that is indeed a sort of a mindset change. So to summarize, there are a lot of excellent professors and doctors and students here, but we need to realign them a little bit in a different way. And then the future is bright. Because the other hospitals around us, they do very good clinical work, like Rovo, Kopernik, Gdynia hospitals, Katowice, fantastic work. But they never can do development in research, clinical clinical trials, or maybe Narkiewicz can say something about this. But because they don't have these tools, we have the obligation to our healed patient to do everything to reorganize ourselves that we do better than we do now. So we can be the center of excellence in the North Poland. I think that the odds are good, but we just have to say, let's do it.
Okay, thank you. And Professor Narkiewicz?
I think the greatest opportunities for us, I think, is teamwork. This is what was mentioned by Paul. First of all, to abandon the concept of clinical medicine and basic science, I think it was a kind of huge mistake. Right now, we call basic science discovery science because they developed new concepts which one day could be translate into better management of different diseases. So I think it's what we try to do with the concept of central medicine translacyjnej, really try to merge different groups. So I think this is an enormous opportunity. And we are really very strong in clinical medicine and in discovery science and the College of Pharmacy, Biotechnology. So there are many opportunities. I think what makes really the Medical University of Gdańsk special is a kind of relationship we have. When I hear, of course, we have some problems with us, but basically our university is very friendly, or is more and more friendly every day in the way we respect each other, and we try to really incorporate the best practices all over the world. So I think it's crucial to create teams, to know each other, to enjoy this what we try to do, and work at the same time on excellence in clinical affairs, in research and teaching. And I think this is also because from outside we are perceived as as one team, one group, one university. People do not identify, a person or maybe department. Maybe in the countries, yes, but to be internationally recognized, you must create a really very, very strong team. So I think this is the opportunity. We did a lot in the last years, and I think sometimes it's very visible, sometimes it's a long way to go. And but I'm very optimistic, and I think we start to be attractive for people from even abroad. Like Paul decided to come here because he can contribute to development. We recruit people also from other universities in the country, and I think we try now to recruit the best students. So the initiative to have kind of special meetings with the those who consider studying medicine, I think is crucial. So I think there are many opportunities. Of course, there are many threats, including whole concept of teaching and education in Poland. But I do not want to complain too much. So maybe let's leave it as it is. And probably at the moment we try to create a little bit, our cocoon separated from the problems of the rest, and I think right now really we should do our homework, establish international collaboration, and try a little bit to ignore the surrounding. If we work hard, if we make progress, one day it will pay back. So I think this is my current thinking.
Okay, thank you very much. And from your responses, I'm taking down some notes. Human factor, respect, and interdisciplinary teamwork. Thank you. The next question, I entitled this question, "The show must go on." And what I mean is actually that generations come and go, and science have to roll on in service of the patients. And the patient care and best education possible have to be provided by newer people who come, get educated, and some of them stay with the university. What are the key magnets attracting young talents to the university? And what can we do more or better to raise new generations of successful physicians, researchers, and medical teachers?
Well, I would say first that the young who are in school, on the secondary school, they should have more awareness what is going on in the Medical University of Gdańsk. Some of them have just, not out of the blue, but out of their family history or another thinking. They have the idea to be a researcher or a doctor or in medicine to be there. And their profile actually should somehow be fit to what we as a medical university have to offer them. So the young generation is not demanding per se, but they're asking the right things. So our teaching system and to educate and so embedding new talent should follow, let's say, the developments in society, which that the young people are used to internet, they are used to a very modern way of education. And we should go on with that. We should go along. So the Medical University of Gdansk first should, and that is already currently going, there is a program already practicing today that scholars can come in and see what is going on in this university. They practice some simple medical things to do. And then our teaching system should be, let's say, modernized in a way that that we teach them to be good doctors, not, let's say, in 40 years back, thinking about university training in medicine, because that doesn't fit also to the current practice. So the young doctors bedside, they should understand already very early on in the first or in the second year to be exposed to clinical care and the importance of including science in the clinic, and see that the teachers should step down of their hierarchical position. Teachers, in my opinion, and I will use the word minister, the Latin word for servant, professors, lecturers, and teachers are serving the students. The students are not there for us. We are there for the students. And that is also a part of the attitude change. I think that it should be more horizontal. It should be clear that the teachers have the knowledge, the students have to learn it, so they are not the determinant of the, let's say, the syllabus or what they have to be learned. That is what is up to the teachers. But there's a sort of a mutual respect. Because once you have learned and have seen that your teachers step down from their hierarchical position, when you become a teacher yourself, you will do the same. So I would say we should invest in a different tradition of let's say, how to manage our teaching program in the Medical University of Gdansk.
Thank you very much for this meaningful remarks and thoughts on that topic. Professor Narkiewicz?
Well, I think if we talk about the examples from our university of the departments which were really very successful in terms of bringing young people to very high level training, recognition, and so on, I think about probably the Department of Nephrology. So for me, Professor Rutkowski was a kind of example, how to be a mentor. So I think first of all, kind of identify talents. Not always leaders. You cannot have 1,000 leaders in one department, but talents for different tasks. Then train them. Then I think respect them, challenge them to a certain level that they feel the pressure. But once they are really trained, they are good, let them fly. So I think this is something what sometimes is difficult to understand. At a certain moment, if you identify people who are smart and you train them well, at a certain moment they'll be better than you. At least in some of the fields, and you should be extremely happy that this happens. So it's a little bit my thinking, and this moment that you will have a next generation or you will retire is coming sooner than you think, and the sooner you realize, the better for you and for people surrounding you. And I think in many places a good tradition, if you have to step down a bit earlier before the retirement as the head of the department, I think it's not a bad idea that you do not push, till the very last day. And you think a little bit, if I retire, the whole system will collapse, because then it's, you see, this was so. This is my thinking, that really try to expose your students to different tasks, and try to help them to identify. And this is, I think, the biggest challenge of any mentor or head or the leader. Sometimes it takes a while before you find out who is gifted for a particular task. But once you are able to identify the field, let them go, and they will do it. They will do it. They will deliver.
Thank you very much. Yeah.
May I just add one short sentence? It is not the art to reach the summit, it's the art of stepping down from it.
Very true. And I have an observation on what you have been replying to this question. There is a very strong motive of human factor and interpersonal respect in what you both say, and it's very important. Biology, human body, medicine are very complicated by nature. Medical studies are difficult by nature, but this should never justify any disrespectful relationships between people, and especially between teachers and students. The next question is about internationalization. May seem a little bit obvious, but still, why and how can universities benefit from internationalization? And what are your personal, most precious experiences and observations of done abroad or in international setting?
Well, I would say that politics in the past did not prevent us from doing the right thing. So the Iron Curtain was not a real physical facade for us, not to step over it. So reaching out to other nations and to other, let's say, way of working, so to try to learn it and to see it, and to understand it, it's one of the keys of making progress. So as the example, Narkiewicz came to Amsterdam, but before, my dad was actually traveling in 1955 to the Cleveland Clinic to see Dr. Eland and other people to operate on hearts in these times. So stepping out of your comfort zone, look what other people do, and typically, indeed, what other nations have achieved in medicine. In general, I think that's very important. With that, it starts to build a formal relation. Like in my family, would that happen? But later, I think it's interest, I think, of not only yourself as a person, but for the university and the team that you represent, that you are international. Well, Narkiewicz meant that he was in Iowa already. I was by my Dutch team in Amsterdam sent out already in 1979 to go to San Diego to look how a new heart-lung machine was working. Because the Dutch team wanted to improve. Let's see first what others do, and then learn from that. And then that sparks a lot of different, let's say, processes on which you can step up. So Utrecht was, by the invention of our octopus, to operate on the beating heart to perform coronary bypass surgery, we were already international because we invited in 1995 all international, let's say, top piece scientists and clinicians to Utrecht. There were 80 of them to discuss this new way of working. And through that, so these workshops gave us the idea what other people were thinking. So actually I say is, do not stare to your own umbilical cord. Step out of your comfort zone. See other people, what they do. But to that extent, I was lucky that then we erected a society of international minimal cardiovascular surgery that was taken over the Americans. that take you all over the world. We were teaching all over the world, performing surgeries. And then you see that also, very depending on the social context. Some operations that were thought to be completely out of date here in the Netherlands were very good, for instance, in India. I give you the example. We can replace heart valves using the heart-lung machine. We open the heart, we replace the heart valve. But in India, there are so many people who also suffer from some diseases on a valve that sometimes it's better to stick the finger in the heart and to open the valve with the finger and get your finger out of the heart. That was an old technique practiced before the heart-lung machine was even into place. So still, this so-called commissurotomy of the mitral valve operations is performed in India, and it's doing very well for the majority of the people. So economic context can play an important role. And we learned from that. What I also learned from that we have to be humble. Because the medicine that's practiced in our west side of the society, west side of the world, is a very different medicine in other territories of this globe. And we need to understand that also. So I'm not making a plea, for let's say a sort of, how shall I put this? That we should not diminish our efforts here and not do the right thing and optimize care by new technologies and high-tech medicine. I'm just saying that there is another part we should understand.
Where these achievements are frequently totally unavailable, and it doesn't seem for the situation to improve so much for millions of people around the globe.
Yeah, and an example is, for instance, that in South America and in China and other Asian countries and Russia, they didn't have, for instance, access, like here in Gdansk, access to the heart-lung machine. You could not operate inside the heart without arresting the heart, because blood circulation must continue, of course. So not having a heart-lung machine prevented a lot of people not having the medicine that they should be entitled to. However, because coronary bypass is something that you do on the outside of the heart, surgeons start to operate on the beating heart. But they need devices to do this. So in South America, a lot of surgeons were already ahead of us by operating on the beating heart and not using the heart-lung machine because simply they didn't have it. So the innovation of the octopus actually came out of a sort of a need that was not present in the Netherlands because we had the heart-lung machine, but we looked at the South American surgeons and said, hey, these guys can do it without. Why do we use this machine that harmed the patient? So we improved our medicine by taking their therapy, not using the heart-lung machine, but we invented the octopus. That's a tool that can make the heart stop at a certain area, the heart is beating, and then you can perform the bypass surgery safely. So this is an example for me of internationalization, to look around and to find grounds to do it. By the way, Gdansk University is one of the toppers in performing octopus operations. They do it very well.
Yes. Thank you very much. Professor Narkiewicz, would you like to add something?
Well, I would say this is crucial to be recognized. You should really go to a global scale, European relationship, and so on. I think that the key factor is mobility. It is a challenge because we are extremely good in Gdańsk in terms of students, mobility of students. Probably it's much more challenging in terms of researchers and clinicians for various reasons. I think, first of all, in Poland, certainly in the last few years, it's much less popular to go abroad. People would like to stay here. And also for people from other countries to make a decision to come to Gdańsk, they should be really convinced this is the ideal place to spend a few years of their career here. So in terms of the hospital, the environment, the facility, in terms of finding the apartment and so on. So I think this is extremely important for us, really to work now on getting more people from abroad. And I think the PhD course in English for foreign students, I think is the first step. We have Paul Gründeman, we have two other professors which joined the team, one working in the team of biochemistry. Professor Michel Bournier joined us in terms of clinical affairs. So I think it's extremely good to have really experienced people, kind of mentors. But to recruit, I would say, the middle-aged generation, it is really very challenging. If you talk to people who completed the training at home, who have the families, who have established life to go abroad, they should be absolutely sure this is a unique place that I would like to go. And I think what, just the final remark, I think we should do more. I know it's very, very challenging to recruit people from post-Soviet countries, like Ukraine, probably Belarus one day and so on. Like I spent some time, training abroad and so on. They're really very smart, gifted, motivated. So I think I have a kind of mechanism to bring those smart people for a few years, or maybe even to stay here forever. Why not? If somebody is so I think it might be a bit easier than recruit somebody from Western Europe. Although there are some examples. University Gdańsk with the Center of Quantum, research. They created a kind of international team. They have like 25 people from abroad living here in Gdańsk. I think it is doable, but we have to really work hard to get to this point.
Thank you very much. And actually, the last part of your answer is very much connected with my last question about federalization. The issue is that our university, together with the University of Gdańsk and Technical University of Gdańsk, have established the Fahrenheit Union of Universities in Gdańsk, which is a new step in our interinstitutional cooperation and most probably a great opportunity to increase our research potential and also cooperation at the level of undergraduate and graduate education. Would you like to comment this? How would you like to comment this endeavor, Fahrenheit University, Union of Universities in Gdańsk?
Well, as a doctor, I look at the healed patient. So I look at the opportunities in the region. What is best for our patient care here? If we want to strive for excellence in the region, that means that we should work together intensively with different universities that are at hand. They're our neighbors here. The Polytechnic University has also acquired this very nice status as Uczelnia Badawstwa. It's great. And there are a lot of opportunities to merge our, let's say, our questions to them, which we cannot answer because we are not a technical skilled persons. So we need them, and they need us because they are good in modeling, in creating, and so on, but they do not have the patient. They do have no knowledge about tissue, for instance. So this is something that we can, let's say, be complementary. So the other partner is then the University of Gdańsk, which it has a lot of knowledge that also can be in favor, in the end, to the healed patient. So I see it as a very important step that the Fahrenheit University is actually formed. I see it as in Poland as a very strong position in the future when we see actually the importance of where the friction actually is in between the two, let's say, domains of knowledge and experience and science, and that is technical and medical and organizational and others like in the University of Gdańsk. So I see it as a major step, and we should also, let's say, be able sometimes as doctors or as researchers to visit these entities, universities, to see what's going on there. So I think we had some time ago, we were in Sobyszewo on the meetings of the Central Translational Medicine. Narkiewicz can comment on that, but there was one important issue actually between the Technical University and the Medical University of Gdańsk, and the final conclusion was that we have to close the gap. That was one very strong statement that came out of that meeting. So I see it as an opportunity, but we have to fill it in. People have to step out of their comfort zone. That is for sure.
Thank you very much.
I'm a big supporter of this concept, and when we had evaluation of the Uczelnia Badawcza application, and there was a panel of the best experts, rectors, deans, and directors of different research institutions. When they heard that in Poland we have like 158 university or high schools, they said it is ridiculous. It's not surprising that only very few of them are recognized. So I think this is very natural that we should reduce the number of the universities. And I think in Gdańsk, in long term, there's just a place for one university. I know this might be a little bit too early to say, but I think Fahrenheit University is a brilliant idea. It's a name which could be recognized all over the world. We have different talents in different groups. We could be much stronger. So of course, many details have to be discussed, explained. But especially for research, for innovation, it's probably the best way immediately to start to be recognized. And just talking to the others, because indeed in Sobieschewo we had the meeting with Politechnica, and I met some of the researchers, and the outcome of this discussion was a very close collaboration with the group of Professor Andrzej Czyżewski, who was really a brilliant person, and I was always amazed by this what he did, and somehow he collaborated with other medical universities in Poland, not with us, but now we have like 3 or 4 really exciting projects ongoing, and I think this is the way to go. We plan now on collaboration with Uniwersytet Gdański. So I believe this is the only way to accelerate for the region, and then it could also be much more attractive for people from outside to join us. I mean, both from Poland, but also from other countries to come to Gdańsk, spend some time, and then you could really start to rise as the international center.
Thank you very much. I think that we can strongly believe that sparks of ingenious ideas are born at the friction of different disciplines. So the closer contact between medical university, University of Gdańsk, and technical university can only increase the output and the productivity and the creativity of people involved in those processes. And when I think about Western universities, where they don't have this heritage, post-war heritage, as we do have in Poland, and medicine is a faculty at a university, and students are together, students from different faculties, it makes them richer by a daily contact with students of humanities, of mathematics, and other disciplines. So I think the closer the links, the better the future for us. So thank you very much for this, for these answers. Do we have any questions from our audience today? Okay, thank you very much. We've taken quite a lot of the time. I would like to say that we very much appreciate your readiness to share your thoughts and insights today at this conversation, which we hope to be the first of many such meetings with distinguished medical teachers, physicians, and researchers from both our university and possibly also other guests who may be attracted to cooperation with us in the future. Thank you very much.
Thank you.